So here we have the upper respiratory. The opening to the nasal cavity is the external nares. Okay, not at all. The external nares right here, and that opens into the vestibule, nasal vestibule, opening up into the nasal cavity. And inside the nasal cavity, we have the concha superior, middle, inferior, separated by meduses, which are depressions, superior, middle, and inferior. At the end of the concha is the internal nares. External nair, internal nair. This is the opening to the eustachian tube, and at the very, very back is the nasopharynx. This region is the nasopharynx. We have the pharyngeal tonsil here, and we have the hard plate and the soft palate right here. Underneath the soft palate or uvula, we have the palatin tonsil right here, and the lingual tonsil right here. So this is the oral cavity. All the way back is the oropharynx. This is the larynx or the laryngopharynx. So again, regionally, nasopharynx, oropharynx, laryngopharynx. And this is the segue, the epiglottis towards the trachea. This opening is the glottis. This is the true vocal fold. This is the false vocal fold. So let's take a look at the larynx now on this model. We have
the opening. I'm sorry. This is the glottis.
The opening.
Oh, I
so
thought
if you look
in
right,
here was the glottis.
No, that's a ventricle. It's like a chamber in there between
When you compare the images, that's what it made it seem as if.
Yeah. Okay.
We were confused too.
Okay.
I could draw it on the board for you if you want.
No, I got it. Okay.
I mean, this one here is the false chord. These are the true vocal cords here.
Oh, yeah.
Now, we have the hyoid bone. All right, hyoid bone, thyroid cartilage, cricoid cartilage, tracheal cartilage. Now let's link them together. Thyrohyoid, this anterior ligament here, and the thyrohyoid membrane over here.
Okay.
Ligament, membrane. Down here we have the cricothyroid ligament, cricotracheal ligaments here. These are tracheal ligaments. These are tracheal cartilages.
Oh, I see. I was confused because these are membranes and these are ligaments.
Correct.
That's what the confusion.
All right.
Okay.
And then we have the thyroid gland being cut away. Now, going from the trachea, the trachea terminates at this ridge called the carina.
Right.
It splits into left primary bronchus, right primary bronchus, and then they continue to divide. Left primary bronchus, left secondary bronchus, left tertiary bronchuses. Primary, secondary, tertiary.
Okay.
The surface of the lung is called the visceral layer,
Okay.
or costal layer. The inside cavity is called the mediastinum, and the layer is called the mediastinal surface.
Okay.
This depression in the left lobe is the cardiac notch. That'll accommodate the ventricles of the heart.
Okay.
So the depression is the notch, the layer is the mediastinal surface. This muscle down here is the diaphragm, this whole thing.
Okay.
The flat bottom of the lung is called the base, the pointed tips are called the apex, and again the visceral layer. Oh, finally the opening for the blood vessels is the hilum. So these are the pulmonary veins, and these are the pulmonary arteries.
Which one was the tertiary?
Tertiary's out here. So follow the primary, splits to become secondary. Follow the secondary all the way through. Here it splits again to become tertiary.
Where's the hill? What's the hilum?
The hilum in any system we look at is where the vessels enter and exit.
Okay.
So this is the hilum of the lung.
Okay.
We have the hilum of the kidney, the
Okay.
hilum of the spleen, the hilum of the lymph node. It's just where the vessels enter.
Okay.
All right, this little indentation is kind of the root of the lung.
Very good.
It's kind